Hi, my name's Paul Haslam. I'm a consultant knee specialist working here at the Coriel clinic. I've been a consultant now for nearly 18 years and I've seen all manner of knee conditions in my time. I'd like to talk today about Baker's cyst, which may also be known as popliteal cyst and is a swelling at the back of your knee. Well, what is a Baker's cyst and why do they form? This is a knee model of a right knee, and a Baker's cyst appears at the back due to a little gap in the capsule of the knee. The knee is contained in like an envelope of tissue, and sometimes you're born with a little hole at the back, and fluid can escape into it and it forms a cyst at the back of your knee. So it's nothing to worry about, but people hear cyst, they tend to worry it's something sinister, but it's nothing to worry about. There's normally a drop of fluid in your knee, but if you have anything wrong with your knee produces more fluid. And if you have a tendency to produce a Baker's cyst, this can be forced out through the little gap and it can't get back in. It acts like a one-way valve. The cyst gets bigger and bigger and it can become very uncomfortable, and occasionally they burst. A ruptured Baker's cyst is like a grenade going off in the back of your leg, and the patients really don't like that. They often get admitted to hospital with query blood clots, they undergo scans, and it takes months to fully settle. Now, if you go to your local surgeon or your GP and ask them about your Baker's cyst, you'll probably be told there's nothing you can do. I don't agree with that, and I've successfully treated over 50 patients now with Baker's cyst with keyhole surgery. Now, I'm not saying that every Baker's cyst needs treatment. In fact, it's the opposite. The vast majority of Baker's cysts do not need an operation. If you've got a small Baker's cyst at the back of your knee that's not really causing any problems, leave it. People have tried things like sticking needles in, aspirating it. They tend not to work, it just comes back. If there's another knee condition that you have that's making you uncomfortable, then have that treated. Usually people have the other bit treated, not the Baker's cyst. But occasionally you get cysts that are so big and so uncomfortable, it is worth treating the Baker's cyst. Well, shall we look at this MRI scan? This is an MRI scan taken slicing your knee like this. So this is the femur bone, the kneecap is here, and that's the back of your knee. And this is the cyst here. This is a reasonable sized cyst, and there's a little gap between two muscles at the back of your knee which forms this valve. Often surgeons will say it's not worth treating because it's too close to the blood vessels at the back of the knee. But the blood vessels are over here, completely separated by this muscle belly, which is the medial head of gastrocnemius. So actually, in my series of patients, no one has had an injury to their nerves or blood vessels. The operation is performed keyhole through 3 small incisions, 2 at the front and 1 around the inside part of your knee, about here. And we cut away the valve. If you remove the valve, you remove the ability to make a cyst, and the cyst just drains freely into the knee. If there's no pressure due to the valve, there's no cyst and no symptoms, and we've had very good results with this operation. So if you have been told there's nothing you can do about your Baker's cyst, it's a large enough cyst to worry about, it's causing you symptoms such as pain, difficulty bending your knee, sometimes you get a dragging sensation into your calf, and at risk of rupture, then it may be worth getting that checked out here at the Coriel clinic.